So this is episode 11. I've been saying this pretty much every episode since we started, and I am super stoked that we have made it thus far. It doesn't probably sound like much to a lot of people that we've made it 11 episodes in, but I'm proud of the team, and I'm joined today by Erica and Dylan, and we're going to discuss the topic of women and heart health in particular because it is February 1st and February is Heart Month. And I know this is a topic that the both of you have talked about in the past, have brought up in the past, and have a good level of passion around. So I'm super stoked to have both of you here so that we can discuss a couple things around women and heart health. So thanks for joining me today and joining everybody else watching and listening.
Thanks for having us.
Of course, absolutely.
Did you wear red on purpose?
You know what? No. It was just the shirt that made it today. I wanted a long sleeve, and it's just, I was like, oh, this isn't the most, formal shirt. So I was actually like halfway through changing my shirt right before, and then I'm like, oh, this is a red shirt. Actually, I should probably just keep this on. So then I just chose to keep it on.
Nice.
So it was an
Did you paint
accident.
your room on purpose?
That no, there's you can probably
Just for
if
today.
people haven't noticed yet, you could probably see spackle marks on the wall. I'm actually supposed to be painting this room at some point. So it was not an on-purpose color. So
Got it.
why don't we start, whoever wants to start, to talk a little bit about where your interest and passion comes from when it comes to discussing this topic as a whole. What piqued your interest to wanna do this episode today with me? Let's start maybe with Erica.
With me, yeah. So one of the other dietitians brought it up in one of our meetings, and I kind of thought, well, when it comes to any type of chronic disease management, but particularly cardiovascular disease, I really think that meditation and mindfulness can truly help. And of course, that is my passion and my area of expertise. So I know that a lot of clinicians do prescribe that non pharmacological intervention of doing meditation and mindfulness because it really can help to reduce that prevalence of anxiety and worry and all of those other, worries that come along with managing disease. Um, and I think that there's just a lot to understand about the stress response. We all know about it, but when we start to understand and unpack it a little bit, that gives us more control over not allowing ourselves to get into a state of chronic stress. Because of course, when you're in the state of chronic stress, the symptoms can really be damaging, especially for someone living with heart disease.
We'll dive into a few of those pieces. Dylan, what piques your interest about this topic for you?
Yeah, I appreciate you asking, as it's been something that I've been introduced to personally because I was diagnosed with PCOS when I was 16, and PCOS women are 3 times more likely than other women to develop heart disease. So I was directly forced to start paying attention to my own heart health, and then down the road I ended up conducting my doctorate in the similar research. And I think what part of the passion is realizing that for a long time we only really thought of men being at high risk of a heart attack, for example, or stroke, and also including men in those studies, and not including women. And now we're seeing that there's actually quite a lack of research in how heart disease is affecting women and the different factors and risk factors to look out for, and that it's a huge burden, not just on individuals but families, on the economy. You could go on the burden of heart health, but also it's so preventable. So that's exactly what we're all passionate about, is that there's a lot of factors that we can control, so may as well focus on that.
Yeah, I feel like we could bicker for hours about the lopsided nature of research between genders. I've seen it in so many places, but one point that you mentioned that's a good kind of lead into this topic in a general sense is risk factors, and I know that there are differences between different physiologies and how risk factors for heart disease and different heart health risk factors arise. So, what comes to mind when you think of risk factors in this?
Yeah, I can start. If we're looking at women, I think of pregnancy, especially just how whether it's during pregnancy or after pregnancy, we're often at higher risk of diabetes, gestational diabetes, preeclampsia, and those are risk factors for heart disease. And then that brings up, diabetes in men and women and all genders is going to be a risk factor as well. So being aware of what our blood sugar levels are, our insulin, our cholesterol profiles, and there's others that I'm sure Erica can touch on too.
Not so much. I'm not an expert necessarily in heart disease, but I do know that it's really good, important to understand the risk factors that Dylan listed. But it's also important to understand that they are under people are undereducated on them, and especially women don't actually notice when they are having an episode. So I don't know what the stat is there, but I know that I have family members, people that are close to me that have had heart attacks that didn't actually realize that they were having a heart attack at the time. So they talk about it being the silent killer, and there's a reason for that.
Yeah, a big part of that is high blood pressure, and so that's something that we should really every year be checking our pressure, and that's something you can just go to a pharmacy and they usually have that to do yourself, and then it's you have a baseline because it might not be normal, but it might be your normal, and then you can adjust if you start to see something a little off.
And I think even like something that might be even better than that is to actually invest in that blood pressure cuff for having it at home, because I know that a lot of times there's anxiety going to a doctor, and sometimes that can change your blood pressure reading. And your blood pressure reading is going to change day to day. So actually having a baseline, measuring yourself as much as possible. I know that doctors really appreciate that as well.
I think in some of the clients that I've worked with that have had different experiences, whether it's with heart health or anything, is just understanding that there are differences and understanding that if this is an area that, depending on the healthcare provider that you're working with, the whether or not they're educated in those differences and how symptoms present, risk factors, all of those pieces. I think the point that you mentioned, Erica, about like people's level of anxiety and going to a healthcare provider of whatever sort for this type of a thing, or even having conversations about that, understanding that differences exist between men and women for this type of a thing, and such that you don't want to be like gaslit along the way if there are something that you're looking at or that you want to be aware of or that you want to assess, whether or not there's actually something going on. You just want to be aware and be preventative in nature. I think those pieces are hugely important to being empowered with your own health. Next point up, there's a note about the impact of medication on heart health. What's that? Where does that come into the picture?
As far as medications, all I would say is to work with your healthcare provider on the right medication for you.
Yeah, and understanding when you need certain medications, because I know with heart disease, there's medications that you only take when you have certain symptoms. So yes, work with your healthcare advisor, and just knowing that like what I was going to say about medications is um, it's really important, like if you've been diagnosed, to work with a healthcare advisor, but also knowing that people, and maybe I'm transitioning to a new topic here, but people that have been diagnosed with cardiovascular disease, um, they are under recognized and under treated for depression and anxiety, because we know as healthcare providers ourselves that people that are diagnosed with a chronic disease, they have um, double the amount of, or what am I trying to say? They struggle. They have they have increased odds of developing some sort of depression and anxiety, right? And so these mental disorders actually reduce the ability of people who are managing the disease to adhere to their medications, and any other recommendation and any other like lifestyle changes that they've been recommended. So that's where mindfulness practices and stress management comes in to assist with that part of mental health.
I, I agree too. I would also add that there isn't any shame in taking medication and that sometimes it's the best option. And I know we talk about lifestyle a lot, and that's a core value of ours, but there is still a place for medication sometimes for some people, and it can be life saving.
Yeah, I think it's important to understand the role that any of these different types of interventions have, and whatever is appropriate for your given case, which of course is a good discussion to have with your healthcare provider. Um, but I mean, given the under recognition around depression and anxiety and stress levels, especially in this realm, I mean, you add on top of that the complexities that is how healthcare providers may handle this with patients or clients, given the person sitting in front of them, and that it may be amplified even more, which really opens up the opportunity even more so for things like meditation, mindfulness practices. I think and I mean the level of how much it can support people and what it could do. I mean, I feel like sky's the limit in some ways. Um, let's go into some examples. So if you were thinking about what might be useful for people that are in this realm, dealing with heart issues, or they know somebody, maybe relative friend, um, or a woman in their lives that is experiencing anything to do with heart health, and they want to implement some form of stress management or mindfulness practice, what comes to mind? What would be your go-to suggestion or suggestions that you bring up?
Oh yeah, I mean, um, it's not just meditation and mindfulness. I mean, it could be just making sure that you're having social connections and maintaining good relationships with others. It's being active. It's making sure that your sleep is good. Um, um, you know, Looking into your nutrition. All those different dimensions of wellness will lead to the fostering of self-care. But when it comes to meditation, I think I kind of touched on the stress response, and like, and Dylan, you talked about shame and taking medication. We talked about elevated blood pressure when we see the doctor. That's all because in life, whether you're managing disease or not, there's always going to be fear, and fear can show up in so many different ways. So it could be complications with your health, like what we're talking about today, testing, going to see your doctor, other people's judgment of you and your choices, your own judgment on yourself. That's fear. And so managing stress and understanding the stress response, what it does and what meditation does in a roundabout way is you get to a point where you are seeing, um, you're seeing blocks of time where your heart rate is going down, your blood pressure is going down, your breathing rate is lowered, your oxygen consumption is lowered, your adrenaline levels are down, your levels of cortisol are down, and your all those other hormones that relate to stress go down because you're practicing, you're doing a practice, a mindfulness practice that takes you out of your worry and that fear state and puts you in either the present moment or away from all the rumination of the thoughts that are happening when you're managing disease or when you're, going for all this testing and seeing doctors. And so it puts you more in, it puts you in the driver's seat. It puts you a little bit more in control. Reminds you what you do have control over. So, like, to answer your question, Brandon, there's so many different types of mindfulness meditation you can do. Um, and I mean, it does take, some people enjoy it, some people don't. What I can say is when you get into meditation, the hardest part is adhering to it, because what you're going to find is the moment you sit in silence, your brain is going to really get loud and busy. So yes, so most people don't want to come back because they're like, oh my gosh, I try to sit in silence and relax myself and calm my mind. But as soon as I do that, my brain gets going and I think about all these things I have to do and all the reasons why I shouldn't be sitting here for this 5 minutes, because really it doesn't take that long. But the goal is not to quiet the mind. The goal is allow the thoughts, but to allow them in a sense where you're not in autopilot. How one thought might morph into the other, and then all of a sudden you're thinking about work, and then you're thinking about something totally different. But it's instead you're being this conscious observer. So you're almost, I always say it's like you're sitting in an auditorium and you're watching something play out on stage, but that's your thought. So you're not connected to it. You're almost kind of sitting back and observing it. And when you take that role of the conscious observer, thoughts don't seem to like run away with like a plastic bag in the wind. They almost seem to have a starting and an end. And then when you sit in meditation like that, what happens is through practice, you start to realize what thoughts are coming up, right? And what thoughts are occupying and governing your mind. And then from there, you're consciously recognizing what these thoughts are, so you can make a decision on whether or not it's true or not. Because our minds tell us a lot of negative things, right? So that's mindfulness meditation, where you sit and you ruminate, you allow the thoughts to come up. But there's also other types of meditation. So if you're someone, and you laughed when I talked about how your mind goes out of control when you try to sit in silence, if you're somebody who is unable to sit there because your mind gets so busy, transcendental meditation what might be a good one for you, because this is where you just sit in silence and you just repeat a sound or a phrase, and that phrase might not make any sense at all, and that will allow you to empty your mind. So you'll be thinking about, you might be saying the statement over and over again, but then all of a sudden a thought comes in, and that's okay. We don't push it away. But once we realize we're not saying the statement, we come back to the statement. So it's that present moment awareness, and that's that your object of awareness. So sometimes it's the breath, sometimes it's a phrase.
Is there
So
specific phrases that people should use, or is it just any phrase that would
it
allow
could
you to
be,
be?
I mean, you don't necessarily want something with too much meaning unless you have an intention that you want to continue to come back to. It's actually sometimes works better when there's no meaning at all. So usually you'll have a guide, and a guide will put you through a mantra. Okay, so a mantra is, I'm trying to remember what the definition of it, but it's a vehicle for the mind. It's that's the Sanskrit definition for mantra.
Nice. I can definitely see the value in that, and I know a lot of the people that may be listening or watching, and heck, even people that I've worked with in the past that find a level of discomfort with, they sit down and then they get swamped with all kinds of things in their mind, and yet listening to you describe that process is kind of interesting, because if you apply that same thought process to literally anything that is health, if you're like, oh, I wouldn't want to necessarily, just kind of freewheel it with anything else. I mean, let's take heart health in a general sense. I want to put myself in a position where I am more in control. I am more empowered, or I can get myself to a place like that. That makes really good sense. Instead of saying, "Well, I just want to avoid it because it was not comfortable," and just go on your merry way. I've told people many times that a lot of things that you do is, that you don't have to overcomplicate it, but there's work involved. And this sounds like one of those things.
And not much work, right? Like, I mean, you, if you're starting out, just sit there for 2 minutes and see where you get, and then the next day come back for 2 minutes, make it part of your self-care for the day. It's really 2 minutes is nothing. And I mean, it doesn't have to be you don't have to sit in silence and meditation. I mean, the mindfulness can be anything from, washing your hands and just paying really close attention in a non-judgmental way of what's going on, using all your sensations, because that again takes you out of your mind and into your body and into the present moment. Another thing that is really important and so underutilized is your breath and just a breathing exercise. Before you get out of bed in the morning, doing 4 rounds of box breathing, or no one even knows that you're doing it. But I mean, that is how the stress response works. And Dylan, you probably have a lot to say about the stress response, but we basically have a thought, and then this cascade of chemical reactions takes place in the body, um, which in the end, we end up secreting cortisol, which is okay in the short term. But if we are always in this state of elevation, cortisol being released chronically can damage our tissues. It can damage our organs, right? And we don't want to be in that state. And we always think that it's our mind that governs our body. But actually, like, that is not true when it comes to the breath. Like, the breath is so powerful. It's actually so a breathing exercise that I would recommend for anyone who is like in acute stress or chronic stress and really needs to just calm their body as soon as possible is a breath where you're breathing in and then you're exhaling and you're lengthening the exhale. Because what's happening there is you're massaging your vagus nerve. And as you massage the vagus nerve, it's allowing this hormone, acetylcholine, to be released. And that hormone actually slows your heart rate. So it's not your brain. So your brain having that worried thought or that fear increases your heart rate, that's a reaction. That's our stress reaction. That's fight or flight. But you can actually use your body, a mechanism in your body, to actually slow the heart rate and trick your brain or tell your brain that you're okay, right? So it's I mean, it's just a real good way to battle the stress response. And I mean, especially for people who are managing heart disease, you want to be able to have these little tricks in your back pocket, because the longer you stay in a level of fight or flight, your body ends up trying to conserve as much energy as possible. And so your levels, like your heart rate and your blood pressure, start to recover at higher levels over time if you're not able to stop that response in its tracks. Because eventually our bodies always come back into equilibrium. So we're going to have a stressful situation. And if we just allow our bodies to recover, it will eventually. But it's being conscious of it. It's like, okay, the stress is happening. Oh, I'm conscious of it. I'm going to make it fall sooner, right? So you're not in these elevated states for as long, if that makes sense.
Totally.
Another aspect that I wanted to talk about was the impact of nature on preventing heart disease, and the research is fascinating. I've looked a lot into this because we kind of all know if when you're out in the forest for a day, we feel better. Most people feel better after, and there is a lot of research as to what's going on. We mentioned cortisol drops, blood pressure, stress and anxiety levels, and isn't necessarily the walking or the activity, it's actually just being there. If they compare people just sitting in forest versus walking, sitting does the same as the walking. So of course, if you're walking, you get the movement benefits as well. So it's a double whammy there. But just being among trees, or blue colors like the ocean, rivers, can do wonders. And if you don't have access to nature, then even visual, like video, picture, etc., can have similar effects. And the sounds as well of like birds, um, or running water, the ocean, can create the same sort of physiological response in our body.
Yeah, I love that. I love that, Dylan. I actually just saw the other day an article came up and it was talking about how they have these recovery rooms in hospitals now for clinicians and nurses where they can go and they sit in this room, and it's usually there's a big screen and there's plants and sounds, and people go immerse themselves in this pseudo nature and they come out just feeling so refreshed. So yeah, I love that, and I know that there is research on just a 2-day immersion in nature and how that has similar impacts, like as a PTSD treatment plan, right? So yeah, I think nature is another underutilized tool for sure. Yeah.
So with that, it sounds like, Dylan, that if you don't have access, a valid move could be like, I'm just because I'm sitting in front of computer monitors right now. And sometimes what I do in the wintertime when I'm wanting to feel warm and cozy is I turn on the fireplace channel on YouTube, or one of the many fireplace channels on YouTube. So like, could that be a valid thing of you find perhaps somebody going on a nature walk, or just a live stream, or anything like that, just throw that on the side. Does that do something similar?
Yeah, I have a screensaver photos of forests that I've visited, or you can find them online. But um, I think the real experience is going to be more powerful. But if we don't have that, it definitely has similar effects to use digital resources.
What's funny actually is my MacBook that I have, with the most recent software update that Mac OS has. You can make your lock screen like a dynamic, basically video of like anything in nature, like a city or a landscape of some sort, mountains, whatever else. And I find every time that I open up my laptop and like unlock it, it's like a really nice and serene, just kind of feeling. And it's so like small and not super long, but there's that feeling there. So
That's actually one of my favorite kinds of meditations too. Is guided meditations. Yeah, where they you might be taking me on like a walk through a forest or down to a stream, and that's helped me because I am someone that overthinks a lot, and so I am able to become more of the observer and listen to a soothing voice, and I particularly do that before bed, to calm myself. And often we'll go on like I said, a little walk to a stream, maybe I can envision some fairies or something there, but it meditation doesn't have to be just boring.
Yeah, guided visualization. It's I don't do a lot of that, but I do know that it does work. Visualization, like Olympic athletes use visualization as part of their training because it works. And I mean, just like our stress response, our bodies can't tell the difference between whether we're actually in danger versus, if we're just stuck in traffic. With visualization, it's the same thing. Your bodies cannot tell whether you're actually sitting by that river or sitting on a beach, or if you're just imagining it. And so you do come out with added benefit after a visualization, like you've gone on a mini holiday. Yeah.
That makes so much
hmm.
sense when you put it like that. It's kind of like how anxiety is thinking we're in danger when sometimes we're not. what our body and then trying to recognize that those are thoughts. It doesn't mean they're real or that we're actually in danger, even though our body really feels like it is.
Yeah. I mean, it makes sense to me for sure. And I think, I mean, bringing this back to the main topic of today's episode, I think one of the things that has been floating around in my mind as we've been talking and I know when I have talked with some of my clients and people that I work with about these types of things, stress management, mindfulness, even things like depression and anxiety, and how to navigate these. It's like, oh, it's not going to have a massive impact on whatever risk factor is relevant for that person in that moment. Or, for me to be able to prevent some form of chronic condition like heart disease. But if you're able to shift your baseline, or at least, Erica, like you mentioned, have tools in your back pocket that will allow you to, in those moments, be able to change kind of where your headspace is, even a little bit. I mean, you add that up over time, and that could be quite significant. And I think easily underestimated.
Yeah. And it changing baseline with those practices, and Erica can speak to this, better equips you for those crises that inevitably will happen. So it's not just the meditation itself that's helpful, but it's almost like preparing your body to cope better when your kids have a crisis or your parents have a crisis, etc. And you have to be in go mode.
I think the word for that is resilience. Yeah.
Yeah.
Yes.
Yes. Yeah. I mean, I could talk a lot about what Dylan is saying, but because it's not just about meditation. Like it's meditation can be running, right? That's like a physical meditation. But like there's such a connection between mind and body, whether you're doing meditation or running or making sure that you have boundaries with work or sleep or whatever it is. Like think about some examples, and people, these just sound like, oh yeah, okay, there's mind body connections, but what meditation does is it connects the mind and the body so that we can actually be present and we can be conscious of our actions. Okay, so when we exercise, that's our physical body. We're exercising our physical body. What's the connection to the mind? Well, research tells us we get sharper. Our memory increases, right? Then there's embodied cognition, and that's where Amy Cuddy is a psychologist, and she did some research on if we stand up nice and tall, okay, we're making a change in our physical body. All of a sudden, our confidence goes up, right? And then, then Dylan, you know so much about hormones. You and I've talked about this before, but giving a hug to somebody, smiling, you're secreting feel good hormones. So, and even if you fake a smile, if you're in the worst mood, smile, because those hormones get secreted, right? There's so many little tricks that just can change mood, change mindset, and it's not just there's just so many of them. I could go on and on about it, but yeah. Hmm.
Oh yeah, fake smiles. I mean, it's. I mean, depending on the mood that you're in. I mean, you could fake smile and end up making yourself laugh. Who knows, right? Oh, good times. Well, I hope there was at least one or two little nuggets along the way that people found. I mean, heck, every time I do an episode with people and bring people in to talk about any topic, whatever it happens to be, the ones that we've discussed thus far, there's even something that I always pick up that either I didn't know or that I forgot about, or so at the very least I can say maybe it helps me. But I mean, obviously we're not doing this for me, so hopefully the impact is broader than just me. But any last things that you want to get out into the world before we wrap up the episode for today?
Yeah, for me, I just think that just to summarize what was talked about, we didn't necessarily focus strongly on, risk factors and things like that. But I think for me, heart disease affects so many people. And what we don't necessarily talk about, and even what your doctor may not talk to you about, is that when you're diagnosed with cardiovascular disease or heart disease, your risk factors of having depression and anxiety go up, and everybody is in the same boat. So whether you are managing disease or you're just trying to manage work-life balance or lifestyle, whatever it is, mental health and getting on top of that is really important. And to be your point, Brandon, can make a huge difference in all dimensions of wellness.
Well said. Very well said. Dylan?
Totally. Yeah, I think I would go back to a word that Erica mentioned that we didn't go into detail, but connection, and connection with others around us, nature, animals, and how valuable that is, because we know that isolation is a risk factor for heart disease, and we know that people that have more supportive, like flourishing networks of support are less likely to develop heart disease. So that's pretty profound. And I'm sure it's could be similar for anxiety and depression as well. So reach out to someone, you'll support yourself, indirectly support them too. So it's a win-win.
Love it. I mean, that gives us a shoe in for many potential other episode topics down the line. So I want to take this time and thank both of you for joining me today, taking an hour or however long this episode ends up being out of your day, and maybe we can do this again at some point down the line.